All right, so I think we'll go ahead and get started because we have a lot of questions to go over today in about 30 minutes. So for those who don't know me, I'm Christine Lee and I'm a rheumatologist in Beverly Hills. I'm also on the medical board for Lupus LA, and I'm hoping to connect with a lot of you today and answer some questions. So for a few updates for people who don't know so far about the coronavirus, as of today, it's been reported that there's been a total of about 140,000 cases in the US total. There's been 2,400 deaths reported, and this is national data. In LA, where we are, in LA County, there's been almost 2,500 cases as of this morning and 44 deaths reported. So we are currently sort of following the trends of the higher hit countries, Korea, China, Iran, Italy, and I would say we're about 2 weeks behind Italy in terms of the reaching what we say the peak is. This is why flattening the curve is so important, social distancing, what you've heard already about the situation, because in the next 2 weeks, this is going to be the critical area, not just in LA, but all across the US. And we are doing the best we can. The healthcare workers, everyone is staying home and we hope that we can lower the curve and reduce the number of deaths and cases. A few more updates I wanted to share with everyone today is that the FDA just approved the use of Plaquenil and chloroquine in the treatment of COVID-19. Why this is particularly important and interesting to our lupus patients is that this is a baseline medicine for us. So we'll touch upon that in a little bit. I have a lot of questions about potential Plaquenil shortage, but in terms of the supply of Plaquenil, many pharmaceutical companies, including the ones that make generic Plaquenil, have promised the production of 30 million hydroxychloroquine pills to be provided to the US for treatment of COVID-19, as well as 1 million chloroquine tablets. So for those who last week were worried about a shortage, don't worry, we are making more, we're getting more, and you should be okay with that. I'll answer a few more questions later. So going on right now, I'm going to start at the beginning of the questions that we had, and I'll just start from number 1. So question 1, if you live in an apartment complex and your neighbor who lives right next to you has it, should you keep your windows closed? Anything else to help protect yourself? So this is in regards to what's considered low risk, medium risk, high risk, and when you should feel that you might have to quarantine yourself. So for someone who lives next door to a neighbor who has COVID-19, unless you've had direct contact with your neighbor, generally you're considered little to no risk at all. Even low risk is considered if you're in the same room as someone else, but 6 feet apart from them. So I don't think you'd have to do anything necessarily different. If your window somehow reaches their window or is directly connected, then I would say the risk is slightly greater, but overall you should be okay, and you don't have to self-quarantine if you haven't been exposed in any way. So question 2, can someone have it without having any symptoms? And the answer is yes. That's part of what makes this disease and virus so easily transmissible, is that a lot of people don't have symptoms. And because we don't have testing readily available, we don't know who might have had it already and didn't have any symptoms at all and is now immune. So I really think that it's very important in the next coming weeks that we come up with a way to test for antibodies, because if you can see who's already developed antibodies to the virus and you may not have felt anything at all, then that would suggest that these people are able to go back out in public and you don't have to quarantine yourself anymore. So question number 3, have there been any COVID cases in lupus patients? So speaking from my clinic and my cohort, myself, we've not had any lupus patients develop COVID. Now, this is just a micro section of LA, so it's very possible that other rheumatologists do have lupus patients who have the coronavirus. However, we are nationally and worldwide developing a rheumatology network for looking at coronavirus patients. And so this will look into who of the RA patients have it, who of the lupus patients did, etc. Right now, we don't have that data readily available from China or Italy. I think it's a little bit too soon. From China, we have had some evidence of, you know, people that might be at higher risk, and that would be people who are immunocompromised, many including yourselves, but also those who have lung disease or the elderly or over 60, 65. But specifically looking at autoimmune comorbidities, we just don't have that data yet. So another question is, are symptoms the same for lupus patients? And I would say, again, that I haven't had any lupus patients that have it, but presumably so, it shouldn't be any different. The main things to watch out for, as I'm sure you've heard before, are fever, cough, shortness of breath, sore throat. Those are the main symptoms that have seemed to pop up again and again for all the patients who have ended up testing positive. So another question is, are lupus patients more susceptible to complications or severe symptoms? And specifically those who are on certain medicines such as prednisone and Cellcept. So the answer is yes and no. So lupus itself may not make, the disease may not make you more at risk for developing or catching COVID. The issue more so is the medicines that you're on. So a lot of lupus patients are on antimalarials, Plaquenil specifically. And Plaquenil itself is not so much an immunosuppressive as it is an immunomodulator. So it helps calm the immune system down. So when you're autoimmune disease, your immune system's a little bit too revved up. So it helps calm that down so that you don't flare from an autoimmune perspective, but it doesn't necessarily lower your immune system. Now, other medicines that you use when you have more end organ disease or more serious disease, such as Cellcept or methotrexate, Benlysta, things like that, they do make you more prone to getting sick, and they are immunosuppressed. So in that aspect, yes, you would be more at risk to develop COVID. So that particular group of lupus patients would be considered high risk. Now, another question, does Plaquenil use show better outcomes for lupus patients? Now, looking at this globally, and lupus in general, yes, it does show better outcomes. So people who are on it, you have a decreased risk of flare, a decreased risk of end organ damage from lupus itself. Now, as a preventive medicine for COVID in lupus patients, that we don't know right now. We don't have enough data, but presumably so. And as we do, as the months go along, we do collect more data, and we have this rheumatology registry that's starting, we might be able to see that maybe it is true. All the patients that have been on Plaquenil for years on end may actually have some protective benefit. But in terms of, I've also just heard from other patients who aren't lupus patients but just want to know if Plaquenil is preventive against COVID. I wouldn't suggest just taking Plaquenil willy-nilly just for the sake of trying to prevent COVID. But if you do develop the symptoms, it is a potential treatment option. That's what the FDA approved today. So another question, so this is interesting and relevant. So it says, I am on daily immunosuppressants and I am having my groceries delivered. How concerned should I be about the packaging? What is the best way to sanitize them? What about medication bottles? So this is really how we're getting most of our groceries and food delivery and what we want to eat and keep the restaurants open these days. So this is very relevant. It's generally considered very low risk to get groceries or food delivered because of the contactless delivery. So now the main risk is person-to-person transmission. When you eliminate that factor and say someone drops the groceries off at your front door, they're not anywhere having skin-to-skin contact with you in any way. There's no handshaking involved. I would say the best thing to do if you wanted to be extra safe is to wear gloves when you open up the packages of groceries. Take out your groceries, immediately take off your gloves and your bags and throw them outside. So not in your trash can, but just get them out the door. I would say that's just the easiest way. And then, you know, wipe down. If it's medication bottles or anything with packaging, you could wipe down with Lysol wipes. And otherwise, it goes without saying, fruits and vegetables, wash them very carefully, which you should be doing anyway. And that should be fine. So another patient says they have lupus and antiphospholipid syndrome. So for those of you who don't know what antiphospholipid syndrome is, it is an autoimmune disease associated with antibodies that increase your risk of clotting. So, and it's often associated with lupus patients, so higher risk of miscarriages or blood clots. So for this patient, he or she says they take Plaquenil and baby aspirin daily. How at risk am I considering my illness? And so I would say they're being on Plaquenil alone or aspirin, they're not immunosuppressants, so it wouldn't necessarily make you more higher risk of getting the virus. Of course, with antiphospholipid syndrome and the higher risk of developing blood clots, I'd say the important thing is to stay mobile, and even though you can't go far, but short walks or walking around in your house to decrease the risk of blood clots would be the best option for this particular patient. So another question, very important, is do you think lupus patients should reduce drugs like chemotherapeutic agents, prednisone, and biologics during this time? So I think this is a difficult choice for many of us rheumatologists and patients involved, and I've had this question already from a lot of patients as they're wondering, we're on these immunosuppressants, is this a bad time to be on them? Is this increasing our risk of getting the virus significantly? And I would say many other rheumatologists would say, no, don't stop your medicine, especially for lupus patients, because so many of your medicines are tied to whether or not you have end organ disease, whether that's lupus nephritis or vasculitis of the skin or lupus cerebritis. These are serious, serious problems, and if you don't fix them or keep them at bay, you can flare in a significant way that can be even worse than getting the virus. So no, I don't think it's a good idea to stop your medicine. Now, I always do feel like, in general and not related to the virus at all, is the minimum effective dose is the best dose. So if you're otherwise doing well and you've been doing well for a long time, then sure, it's reasonable to decrease your methotrexate, or it's reasonable to decrease the Cellcept, absolutely. But it shouldn't be done on your own, and you should definitely talk to your rheumatologist about what the plan might be. A patient said she had lupus a long time ago, and they were taken off medications because the Plaquenil was affecting her vision, and so whenever she has pain, she takes either Motrin or Aleve. Now, the question was, with COVID-19, it's not recommended to take Ibuprofen, but what about Aleve? Is that safe to take? So I would say that Aleve is also an NSAID, which is a non-steroidal anti-inflammatory. So it's basically the same thing as Ibuprofen. I would say that there's no data to say that you should stop it if you don't have any, say you don't have any symptoms and you normally take it anyways for pain or anti-inflammatory purposes. That's totally okay to continue. Now, should you develop any symptoms that could be suspicious for COVID, then I would stop it at the time, because there is some basic science literature that because of the mechanism of action of NSAIDs like Ibuprofen, they can actually ramp up production of something called ACE2 in your lungs, which leads to worsening of the of basically lung inflammation, which is a big problem with a lot of the more serious COVID cases. And in that case, I would take Tylenol for pain. So another question is, we kind of went over this already, which is, should lupus patients stop immunocompromised medicines during this time? And for those who missed me talking about it in the first half of this video, no, you should not stop your immunosuppressants because the risk of flare is so much worse than potentially the potential risk of getting the virus. One thing is this person is also a type 1 diabetic and is struggling with the use of prednisone and also wants to know about methotrexate affecting the immune system. Yes, methotrexate is an immunosuppressant, and so it is something that, say, if you were to get ill, we would stop it for the time being, but otherwise you should continue it. So next question is, should I still be going to work if I have lupus and am on immunosuppressants? So this depends on your line of work, whether it's office-based, whether you're interacting with a lot of people at one time. And so I'd say talk to your rheumatologist, and it's a case-by-case basis. For those people who can work remotely and are allowed to work remotely, that's absolutely the best thing right now. If you do have to go in, it just really depends on your line of work. So we'll move on to Plaquenil shortage questions. And I touched on this at the very beginning a little bit, but we'll go into more detail. So question is, what is happening with Plaquenil, and how can we make sure lupus and RA patients are able to get these essential medicines? So this is a big factor for our patients. We have a significant amount of lupus and RA patients in my clinic. We have been able to send in Plaquenil refills for most patients. Where we run into trouble is getting 90-day supplies. If you go to a regular local pharmacy, I'd say your chances of getting 90-day is pretty much nil at this point from what I've seen over the past 2 weeks. Many are able to get 30 days, but then there's a shortage. And I've had better luck with online and mail order pharmacies. So places like Alto Pharmacy, Express Scripts that are mail order, generally because they are like a bulk supply like Amazon, they have more Plaquenil just on hold in storage. And so that's always an option for patients too. Now, another thing is what is recommended for lupus patients that cannot get a refill of their Plaquenil and are running low or completely out. Literature states we won't go into a flare for a few months, but most of us know from experience a flare will start within days of being off of it. So I would say right now we are working with our patients, like I said, on getting Plaquenil through mail order. Plaquenil does stay in the system for about 3 to 4 weeks after you stop it. So you shouldn't immediately feel bad, although I know many of you anecdotally do have that sort of feeling. There's always other things we can do to get you through. Kenalog injections, a short course of steroids, not ideal, but really that's something we could do. And something to talk to your rheumatologist about, whereas maybe if your main issue is joints or something like that, you could change to methotrexate. But there's different options, so it's not like this is the end-all be-all. And we, as your provider, should be working with you on figuring out like what would be the best option for each individual. So another question is, will there be enough Plaquenil for us that need it daily? This is what we've been really advocating in the rheumatology community, and you've probably seen it online too. Multiple providers and patients try and advocate for our patients, the Lupus Foundation America, Lupus LA, etc. And the main thing that we recommend is trying to get those 90-day supplies. Now, I specifically, in my refills for Plaquenil, I write that this is a long-term medication. This isn't just something I'm just using for 30 days and that's it. And I'm happy to get on the phone and talk to pharmacies if we need to about that. No. This one, same kind of thing. How will we get our refills? I touched on that. Do you know where we can get Cellcept and Plaquenil? Same thing, try mail order. And what can be done to secure medication for those of us who need it. So we as providers should be patient advocates as well as you, the patients yourselves. The more people that lobby for this kind of thing, the more publicity, the more outreach that we can get that shows that, hey, these are medicines that we've been on for years. This is what keeps me in remission. This is what prevents flares. I think that getting that to you know the lawmakers, that's the bottom line, and I feel pretty confident that we can do so. So those were the questions that were submitted, and since we had a few, this is supposed to go on 30 minutes, but since we had a little pause, I'm just going to browse through the questions that have been typed in on the Facebook comments and see if there's anything else I can quickly answer right now. So Grace says, is there any truth that using a humidifier next to your bedside table is helpful? Along with my lupus, I suffer from lung pleurisy and often worry about my lungs and COVID-19. So the thing about humidifiers is that they help with you feeling dry, and it can help if you have a cough, but you have to be really careful about cleaning the humidifier and using like purified water, because the last thing you want is any sort of fungus or any sort of mold that grows in the humidifier that can make your lungs more susceptible to injury. And that is something that has been considered in COVID patients, is the risk of aspirating, which is when you sleep and some of your heartburn or anything from your esophagus goes into your lungs, and that also causes lung damage. So it's okay to use a humidifier, just be really careful about it. And let's see here. Do you recommend a lupus patient who stopped taking hydroxychloroquine go back on it during this COVID-19 pandemic? So unless you have active lupus, I would say you don't have to, but it's something to talk to your rheumatologist about, because like I mentioned earlier, it's been approved for treatment rather than prevention of COVID. So if you don't need to take it, it's always better not to have to be on additional medicines. And don't forget, there is always the risk of long-term use with retinal toxicity and on the off chance of any cardiac problems or arrhythmias or cardiomyopathy. And we'll do a few more. It's kind of the same question. Okay. Is Benlysta an immunosuppressant? Yes, it is. What would you say about a patient who always has a warm temperature in this testing? So for patients who tend to run warm, that's okay, but if you have a temperature that's off the charts for you, so some patients tend to run cold, and so they're always running at like 96, so for them 99 can be a fever. You're the opposite, so you would be, say you run at 99, then you'd have probably a higher temperature, and that would be a little bit more concerning, but it's also how you feel. So it's not just temperature alone, but it's if you're having any upper respiratory symptoms. One more question. So is it safe for lupus patients to go to a doctor's appointment right now? I would say that most offices in general are moving to telemedicine for follow-up, including my office. So unless there's a big need to go in, actually, I'd say telemedicine can cover a lot of your rheumatology needs. And that is also, we're all doing our part for social distancing. And so I'd say if you're given the option of telemedicine, take that for the time being until maybe May or even June. All right, and I think that's pretty much most of the questions. Some are similar. So we'll end this now, but I'm always available by email, or we can do another video at some point. And I want to say thank you to Lupus LA for having me here. And thanks to all of you for tuning in, and have a good night. Bye.